Good evening. Thanks for joining us for Facebook Live Wednesdays. My name is Leslie Fontenot, and I'm the Senior Marketing and Operations Director for Black Health Matters. I hope you all are really staying safe and healthy as we continue to fight for Black lives and justice. And, we at Black Health Matters have always prioritized the health of the Black community by providing information and resources to help you in your personal health journey. So today, what we're going to do is talk about cancer protocols in the age of COVID-19. And joining me for this important discussion is Dr. Karen Winkfield. She's a nationally regarded radiation oncologist who is the director of the Office of Cancer Health Equity at Wake Forest Baptist Comprehensive Cancer Center in Winston-Salem, North Carolina. Dr. Winkfield specializes in the use of radiation therapy for the treatment of blood cancers such as lymphoma, leukemia, multiple myeloma, and breast cancers. She received her MD and PhD degrees at Duke University through participation in the Medical Scientist Training Program sponsored by the NIH and completed training in the Harvard Radiation Oncology Program. She's a national expert in community engagement, and her research is focused on the design and implementation of programming to reduce sociocultural and economic barriers that contribute to disparate health outcomes for racial and ethnic minorities and underserved populations. And on top of that, she has a really beautiful podcast called Three Black Docs, and she runs this on Tuesdays on Spotify as well as Apple and other podcast systems. So joining me today is Dr. Winfield, and I'd like for you to give her a warm welcome here.
Hello.
We have a lot to talk about today. Thanks for joining me, Dr.
We
Winfield.
do. Thank you. Thank you so much, Leslie. I really appreciate the invitation. So thrilled to be here with Black Health Matters. And to the listeners, the viewers who've decided to show up this evening, particularly those who are of our Black constituents, we really want to thank you. There's so much going on right now. And I tell you, the last couple of weeks have been so incredibly painful for many of us. And so I want you to know that I see you, I feel you, and I'm very grateful that you decided to join us to talk about our health, because our Black health matters just the same way that our Black lives matter. So thank
Yeah,
you very
yeah.
much for being here.
And thank you so much for joining us for Facebook Live Wednesday. So the first thing, we have a few questions that we've gotten from people over the last few weeks, and one of the big watch outs or things we're noticing is that with some of the doctors' offices, activities have changed over the last 4 months in terms of
Yeah.
patients and protocols. And what type of things have you had to put in place? What changes have you made in your practice?
So that's a great question, because unlike some other diseases, cancer doesn't care about COVID. It doesn't stop for COVID. We still have to treat patients with cancer. And so we
Mhm.
really have had to struggle with developing protocols, developing ways that we can first and foremost keep our patients safe, keep their families safe, keep staff and faculty safe as well. So I tell you, there's been a national discussion about the best way to go about doing this, both from a medical oncology standpoint, which is where you get systemic therapy, but
Mhm.
also from a surgical oncology standpoint, which patients can potentially be delayed to start their surgery, and certainly from a radiation standpoint. As a radiation oncologist, we really have had to adjust the way that we do business. I'm fortunate enough to work at a comprehensive cancer center, as you mentioned, which means that we have all of those disciplines, and including pathology and radiology, in the same building. And so we actually have screening protocols. Everyone must wear a mask when they come in, patients, and if they're coming with a loved one. We actually had shut down for a while, and we're not allowing family members to come in, which, as you can imagine, is
Right.
really difficult when a person has a cancer diagnosis, to be
Mhm.
on this journey solo, if you will. And That has laxed a little bit. And so we are allowing for family members to join, but usually only one. But still, everyone has to be masked. They get their temperature taken when they
Mm.
walk in the door. And radiation is different from systemic therapy or even surgery, right? Surgery typically tends to be a one-time event. Chemotherapy, maybe an infusion that's given every couple of weeks or so. Radiation is every day. It's Monday through
Wow.
Friday. It's not
Mhm.
holidays or weekends. And so we need to make sure we're keeping people safe. So everyone wears a mask. Patients clean. And so, again, we really want to make sure that all of the things that we're doing are about safety. And,
Right.
we have had to delay some folks, but, those are the ones that we really feel we can delay safely. But we have begun to open up again and are really just making sure that we're doing what we can to keep everyone safe.
Yeah, and that's so important. So to that point, there are a lot of people that have talked about coming in and getting screenings, and there's some concern from individuals out here as to whether you should go in and get your regular screening during this time, during the pandemic. What do you say to that? If people want to go in and get their screening, or they're fearful of getting a screening right now, and we're talking about routine screenings.
Sure, sure.
Mhm.
So routine cancer screening, and I think it's important. This is a great opportunity to talk about what types of cancers we can screen for, right? Breast
Right.
cancer, so that's a mammogram. Cervical cancer, so women's cancers where you get a pap smear, an HPV test. We can test for lung cancer now, which is a low dose CT scan. We can
Mm,
test for
okay.
for colon cancer, which can be
Mhm.
stool test or it can be a colonoscopy, which is a more invasive procedure. And we also can test for prostate cancer. And, there's a lot of
Mhm.
misinformation about when to test for that, but that's a blood test or it can be a physical exam. So it really depends on which type of cancer you're being tested for, whether or not there's even an option available. So at our institution, our radiology department had actually closed down until we figured out and got our hands wrapped around the best way to keep everyone safe. And so we were not doing mammograms for a while. Same thing with colonoscopy, which again, that's the gold standard, but you can certainly do, you know, blood cards if you wanted to, or stool
Right.
cards, and that's something that really is not anything that's invasive, or you could still do that. But a colonoscopy was considered an elective procedure and was on
Mhm.
hold until we opened up the surgical procedures. So, what I tell people is if it's for routine screening,
Right.
have a conversation with your doctor. If you're afraid and you don't want to come in, delaying for a short time is not going to be that problematic, right? Colonoscopy, if you've had one in the
Mhm.
past, is every 10 years, if you've not
Right.
had any polyps or any findings. But I want to reiterate, if you have symptoms, if you have a lump or a bump in your breast, or if you're having bleeding from your rectum, or if there are other signs or symptoms that you're concerned about, please do not hesitate. Please go ahead and call your doctor and get an
Mhm.
appointment to have someone evaluate you. And still, it's important to have a conversation with your doctor around routine screening if indeed you do have a primary care doctor.
Yes, and that is such great advice for sure. One of the things too that some cancer patients actually worry about is what's their risk, of actually getting COVID if they've had cancer in the past, if they have a history of
Yeah.
cancer, or even treatment like radiation and chemotherapy. What's the risk there? Are there health complications involved?
So it's interesting the data that's come out, and we recently had a conference. It was the American Association for Cancer Research recently had a virtual conference. Everything is virtual now. We're all sitting on these Zoom and WebEx meetings all day. And this annual conference was held virtually, and they actually dedicated an entire 2-hour session on cancer and COVID. And it talked about the increased risk that cancer patients have of having complications from coronavirus. So, you know, eh, they had individuals there who were from China. Remember, this started in China, or
Right.
the first case that we know of was documented in China. And so they've had the longest experience, and they were able to present some of their data that does indeed show that individuals who are of older age, those who may have lung cancer, they tended to have more complications associated with coronavirus, and including increased risk of death. And so it is hard. So, even when we looked at France, Italy, Spain, those were other countries that presented some data. There did seem to be an increased risk of complications, but not for every cancer. So it was fascinating. I think it was France. They actually showed that breast cancer patients didn't seem to have a risk that was almost about what the standard population or regular
Mhm.
non-cancer patients would have. So the risk is really related to the type of cancer that you have and also how sick you are. So if you have other diseases, other comorbidities like heart disease or diabetes, obviously you have a higher risk, and also older patients. So older age was a risk factor for having more complications in patients who unfortunately contracted the coronavirus.
Wow. Okay. That's a lot of information in terms of whether you have cancer now or whether you've been through chemotherapy. And I think someone just asked the questions, does having received chemotherapy or radiation in the past raise your risk for getting COVID or even having a more serious type of illness?
Yeah, so that's a really good question. I think anytime we have cancer, that is in some ways a disease that reduces our body's ability to fight against diseases or other
Mhm.
diseases like infections. And so there may indeed be a slightly higher risk of people developing coronavirus, but we're really still gathering the data about that. The most compelling data is the data that suggests that if indeed a person has had radiation or chemotherapy in the past, that they may indeed have a slightly higher risk of complications. Again, not for every cancer. It depends on the cancer type. Remember,
Right.
this coronavirus tends to like the lungs quite a bit, and it causes a lot of problems. So you can imagine if someone has a lung cancer or had a history of lung cancer, maybe they had part of their lung removed, or maybe they had radiation to their lung, and so they only have a part of their lung that's really functioning well. So they're maybe at higher risk not only of developing or contracting coronavirus, but also potentially of developing complications thereof. And so it's really very interesting. We are learning all at the same time because this is a brand new coronavirus. And so we're learning about how this disease impacts and influences cancer care. And so, we really want to stress to patients who are cancer patients, past or current, to really do what they can to protect themselves. And I think that's really the most important message. And we're still learning. And again, this data is brand new. It's been published, which is great, particularly the data out of New York. And what's fascinating about the New York
Mhm.
data, remember, the coronavirus we know is disproportionately impacting communities of color. In
Right.
Winston-Salem, we found that 60% of the new coronavirus case, the new COVID-19 cases, are in Hispanic populations.
Really?
In Yes,
I didn't even
in New
know
York,
Winston-Salem had that larger percentage of
yes.
Hispanic
Well,
population.
it has one of the fastest growing Hispanic populations
Mhm.
in the state, and so but we also have a lot of migrant workers and individuals who are
Right.
working in areas where they can't social distance. But we also know we've heard the stories out of New York or Milwaukee or other states where they have Detroit, where we see that African Americans are at the highest risk of developing complications related to COVID-19 and also dying of the disease. And so the
Right.
challenge is that the New York data that was presented at this conference I was mentioning was actually done in the Bronx, which has a
Wow.
very
Yeah.
diverse population. And so the question is, were the increased deaths that we're seeing related to cancer, were they related to the other population? It's going to be really interesting as all of this data continues to get compiled to really kind of have clarity around which specific diseases have increased risk. Again, in terms of cancer, we know for sure lung cancer, individuals who
Mhm.
have older age who have been diagnosed or have been previously treated for cancer, and also those who have other comorbid conditions or other diseases like high blood pressure, like diabetes, they are at increased risk of having complications, even if their treatment for cancer was in the past.
Yeah, and that makes so much sense. And you think about the Bronx and other areas, especially New York, which is very densely populated, and then you think about someplace like Winston-Salem where it's not.
Hmm.
So you know that it can happen anywhere. It's not just everybody at first
Yeah.
thought it was only because it was densely populated in New York, and now we're seeing it across the country, especially as we open back up.
Yes,
Yeah.
yes, absolutely. I'm sure you probably heard the statistics that there are probably about 24 states now where the incidence, the new cases of coronavirus are increasing. 24
Oh,
states.
that's
And
incredible.
so, we have to be careful. We might think corona is gone, but it is still here, and we still have to be safe in terms of
Right.
how we're going to protect ourselves from contracting the virus and then any complications from COVID-19.
Yeah, definitely. And as it relates to complications, one of the other questions I had was around what can you briefly describe what immune compromise means
Mm,
and
mhm.
how that impacts COVID-19, a person getting it?
Sure.
Hmm.
So, our immune system is the body's defense against diseases. It can
Hmm.
be diseases like viruses or things that are caused from bacteria. Our immune system is actually involved every day in protecting us from cancer, believe it or not. So that's why, in many ways, cancer, the development of cancer, is in many ways a dysregulation or the immune system is not working well. Our defense system is not working well. And so it's comprised of cells and other proteins and things that help our body fight off the diseases. So when someone is called immunocompromised or immune compromised, again, that just means their immune system is not working well. It can be caused by lots of things. I already mentioned cancer. Cancer treatment, so chemotherapy, can certainly impact and lower a person's defense system. There's an entity called neutropenia. That just means that their white blood cell counts are really low, and
Hmm.
persons are at increased risk of having infections. But things like smoking, again, that can actually reduce our immune status. Diabetes, cardiovascular disease. So there are other things that can impact our immune system. Um, if a person has arthritis and needs to take chronic steroids or lupus, those are conditions and medications and treatments that certainly can increase or decrease one's immune system and increase risk for contracting coronavirus.
Are there certain things that you can do even as a cancer patient, knowing that, what you eat or exercise, or I know there's the regular things we tell everyone to do, but is there something else they can do to build up their immune system?
Mm. So when it comes to building up your immune system, I think there are lots of schools of thought there.
Hmm.
Certainly, when people are under active treatment, it's harder, right? You're
Right.
constantly your body is under constant stress, and we know stress alone
Hmm.
causes a reduction in our immune system. Hence the reason why, again, I think Black people under so much stress on a constant and daily basis have increased risk for so many diseases because our bodies are chronically stressed. So the things that we can do, getting enough rest,
Right.
eating healthy diet. What does that mean, healthy diet? I always tell people balanced meals and making
Hmm.
sure you have enough protein that helps your body to repair. Staying well hydrated is important. Drinking water, not a lot of carbonated beverage or sugar sweetened beverages, which can increase risk for diabetes and inflammation in the body. And exercise, as you mentioned, is really good. Number one, because it helps you feel feel good.
Right.
One of the challenges with cancer right now with COVID, as I mentioned, it can be very isolating. Cancer
Right.
is such a scary thing to have to go through in cancer therapy. And with COVID, we may not have our same support systems right there in person. And so I tell folks, I really want my patients to be physically distant, but not socially distant, right? We want
Right.
people to still remain social contact because
Hmm.
mental health is so important. And that mental health can really help us to stay strong. And believe it or not, that mental health, that spiritual mind body connection is really critical too in terms of helping our immune system remain in balance.
Yeah, that is so true. We have a question here, and it's from a Carmelita. And the question is, do you have advice on immunity boosters?
So, not particularly. I know there are lots of things that are available commercially that are touted to boost your immune system.
Mhm.
I certainly think one of the things that oftentimes we lack in our bodies is something as simple as vitamin D.
Right.
Uh,
We're all going to mention
so
that too.
that's not one of the commercially available immune boosters, but
Mhm.
vitamin D does so much. We tend, particularly in this day and age where we're um, in lockdown, we're not
Right.
outside as much as maybe we used to be. We're not getting that sun exposure. We're not getting as much vitamin D. And in fact, we know that African Americans tend to be more vitamin D deficient than other populations as well. So I think even just doing something as simple as getting some vitamin D or taking a multivitamin as we get older. I just turned 50, so everything now is about age.
Sure.
So, but I think that is probably more useful than maybe taking one of the commercially available immune boosters.
Yeah, well, that definitely makes sense. In terms of reopening and COVID-19, um, one of the things that people are concerned about, whether they're cancer patients or not, how can they go back to the things that they like, and especially if you're a cancer patient, because or you're on radiation, a lot of times you want to be outside, and it's sunny and all of that. What do you suggest? Um, for
Yeah, it
people.
is so hard right now. And I think the challenge, as I just said, 24 states with increasing rates. We see what happened in Florida.
Right.
Florida almost has 200 times this week, they almost have 200 times the number of cases that they had a couple of weeks ago.
Wow.
And a lot of that is related to people going out and being on the beach. And I understand it's really hard. And we've been, on lockdown for so long. Um, but I think it's really important to play this as a long game.
Hmm.
But being outside has less risk than if we are enclosed around people. But I still think it's really important. Here, I work with our national organization, the Advisory Committee on Cancer Coordination and Control for the state of North Carolina, and I'm on the advisory board. And we
Hmm.
have our three W's, right? So wear a mask, wash your hands, definitely for 20 seconds. We forget that. I forget that. Let me not put we.
Hmm.
I sometimes forget to wash my hands for 20 seconds, and I'm like, ooh, that was short, right? So 20 seconds. So wear a mask, wash your hands, and then wait 6 feet apart. So really making sure that we're staying as far apart from individuals as we go out to the stores, or we're kind of, even as we're walking around, trying to stay somewhat distant from people will help to reduce our risk. And I must say, particularly for my cancer patients, even in good times, even when before COVID was around,
Right.
I would always encourage my patients to make sure that they're really reducing their risk in terms of staying away from anyone who has sick symptoms. So, reducing sick contacts.
Right.
So it's not a bad thing. Like if you know you have a son or daughter who wants to come and bring you meals, it's okay to say, hey, have you had any cough? Have you had fever recently? It's okay to ask those questions. And hopefully your family will already be thinking of you. If you have a cancer diagnosis, they're going to be thinking of you. They're going to want to do what's right for you. I know patients who've not been able to see their grandchildren while they're getting chemotherapy, and they're so excited when they get to reunion. And the beautiful thing again, it's really about physical distancing. We now have our iPhones, those of us who do, our smartphones, where we can hopefully do visits, remote visits. It's not the same, but these are the tools that we have at our disposal now to really do the best that we can to reduce our risk, particularly if we are undergoing cancer treatments.
Yes. And so one other question around, the three W's. Someone actually was asking the question: is there a certain type of mask that the CDC or someone recommends if they have cancer versus the masks that are available, whether it be the 3-ply or the cloth or anything like
Right.
that? Is there something else they could do to be extra protected other than wear
Yeah,
two?
yeah. I do think that there are some cancers in particular. For instance, if you have leukemia, so you mentioned earlier that I treat blood cancers. That's
Mhm.
leukemia is one of the cancers that I treat. I use radiation to do that. But for individuals, particularly those who have undergone bone marrow transplant, where we give chemotherapy and potentially some radiation therapy, and we essentially wipe out their own host immune system, their
Mhm.
blood cells, and we give them a new donor. Those patients are at extraordinarily high risk of developing coronavirus and complications thereof. So those individuals are actually really encouraged to wear N95 type masks. And actually, we do try to provide those for patients if they can't afford them. So I think that's one of the things that's really important. So for individuals whose immune system is significantly compromised, and remember, they have somebody else's cells in their body, so oftentimes they're on long-term immunosuppression. So they're on medications that actually keep their own immune system lowered so that they can have a really good opportunity to have those new cells that the donor has given them to take up shop in the bone marrow, right? So it
Mhm.
takes time to do that. And so they're oftentimes on long-term immunosuppression. And so it's really important for those individuals in particular to have the masks that we know really reduce spread. Um, Other than that, really, face masks, cloth masks are fine. We do actually give our cancer patients the surgical masks, which are slightly
Right.
different. So they're not the N95s, but they're surgical masks. My challenge is people oftentimes don't wear them properly. Really
Oh,
important,
right.
nose and mouth, right?
Right.
Nose and mouth. Don't have your nose hanging out. I see all the time. People have their mask hanging out. I wish I had my mask. I would show you.
Underneath the chin.
Or they
Right.
have it on their chin, or they have it dangling off their ear. Like, come on, guys. Like, this is about respiration. It's about aerosols, and those are the things that can spray from your mouth or from your nose. And so it's really important to make sure those masks are covering both areas. Now, when people wear a mask, the mask is mostly protecting other people from you, right?
Right.
So, and I think this is really important. There's this thing, I don't want to wear a mask. That's my prerogative. We just need to take care of each other right now. And
Mhm.
what I say is, I wear a mask. I respect you enough to protect you. That's why I wear a mask. But for our cancer patients whose immune system is compromised, and that's the thing, you might be out and saying, it's my right, but you don't know who's standing next to you. You don't know what their status is. So please, please, please wear a mask. Make sure you're wearing them properly. But we do know that even for the person who's wearing the mask, there is a slight reduction in terms of the risk that they have of contracting coronavirus. So it does play a dual role, but mostly protecting other people. And so it's really important to make sure that we're doing our part to keep our entire
Right.
community safe.
Yeah, definitely. And so, with thinking about that, as people are getting back out there, and as we know in our community, a lot of people are suffering without having jobs right now, and also
Yes.
lack of insurance. And so, in a lot of cases, they'll be going back to ER, emergency rooms. We have a lot of people that
Yep.
do that. We have some people that are able to take advantage of telehealth through their health insurance. There's a lot of concern out there, not only just overall the pandemic and COVID, but how will some of these people be able to be treated if they don't have regular insurance, especially if they've lost their job and they want to go back
Yes.
and get cancer
Uh,
screenings and things like that? What type of,
yep.
I know this may be a little bit beyond your area, but what
Well,
type
this is actually right
of,
in my wheelhouse because remember, I direct the Office of
yes,
Cancer Health Equity. So we deal all about making sure people have access. So let
right,
me tell you, that's part of the challenge, and particularly in North Carolina. So I was in Massachusetts for a decade where we had universal coverage. We had Romney Care, right, before there was Obamacare. We
right,
had universal coverage. Our uninsured rate was about 4%. And I moved down to North Carolina where some of the counties that I serve have 20 to 30% uninsured rates. That's before
wow,
COVID.
wow.
And
So
we
now,
know that particularly in our rural communities where oftentimes people may have hourly wage jobs, they may not be salaried jobs, they may not be able to work in an office or work from home, right? That there is a lot of job loss. And so this is such a critical important fact about access to care. And it's one of the things that I've talked about where why is it that our insurance is tied to our job, right? We need to have a better way of doing that. But I think that's being highlighted with this whole COVID pandemic. So one of the things that's really important to remember is that if you've lost your job, you may now be eligible for either Medicaid, emergency Medicaid in particular if you have cancer, or one of the Affordable Care Act exchange insurances. So I think what it's important is just it's worth asking. It's worth picking up the phone and calling. Here in North Carolina, we have a legal aid that actually helps people, believe it or
mhm,
not, to help identify and find resources around insurance. There are other opportunities to look for that as well. But I think particularly if you know you have a cancer diagnosis, it's really
right,
important to get the insurance. If you have a lump or a mass or you're worried about something, please do not, hesitate. Pick up the phone and call. See what resources might be available to you. We know that in North Carolina and other cities around or other states around the country, the CDC, the Centers for Disease Control, actually has a breast cancer and cervical cancer screening program where if you're a part of that program, you get free screening and they provide
okay.
emergency Medicaid assistance for that. So there are some programs. You just need to figure out what might be available in your city or in your state to
Yeah.
help out.
Okay, great, great. So I wanted to thank you again for taking this time. And I also want to talk to our viewers and put in a plug for our upcoming Black Health Matters Summit, which is July 18th. It's multi-topic, it's interactive, it's something that you've never seen before in your life. It's the first of its kind. We'll have a number of professionals, as well as we'll have a number of vendors. There'll be some activities that people can actually do. You'll be able to ask questions of doctors there. And I'd love to have you guys register. It's free and it'll be all day from 8:30 to 5. There's a number of topics. Just go to Black Health Matters summit.bfairs.com and you can actually get a view of how the summit will look. You can register. And then also, don't forget to tune in for Dr. Winkfield's podcast, Three Black Doc. Her next session is on June 26th. It's a live session on prostate cancer. And then also, please don't forget to tune in tomorrow. We have another Facebook Live session with Dr. Kirk A. Campbell, who's a nephrologist at Mount Sinai Hospital. But until then, I want you all to be well, keep safe, and keep the faith. Thank you so much.
Thank you. Thank you, Leslie, for having me. I really, really appreciate it. Have a good night, folks.
Bye-bye. Thank you.